iStock Audio. iStock Audio. Hip arthritis is a common cause of pain and functional disability. There are hundreds of thousands of people that are affected by hip arthritis in this country every year. The hip is made up of a socket in your pelvis and a ball on top of your thigh bone or femur. Where the ball and socket come together, they're covered with cartilage. Cartilage is like the gristle on the end of a chicken bone and gives the joint a smooth, glistening surface. When that surface wears out and the joint swells up in response to it, that's what's meant by osteoarthritis or wear and tear arthritis or degenerative joint disease. Early on in that process, the symptoms may be treated with anti-inflammatory medications, injections, and in some patients, physical therapy or exercise may help. In patients who have significant symptoms and are not treated with not effectively treated with non-operative modalities, a total hip replacement may be considered. In a hip replacement, a new socket is placed into the pelvis, and a new ball is placed. After removing the ball, a new ball is placed with a stem that goes down inside the thigh bone or the femur. There's then a surface between the ball and socket, which typically is a type of plastic or polyethylene, although other surfaces are available. That surgery usually takes me about an hour. You're typically in the hospital for 2 or 3 nights. You need a walker for a week or two and then a cane for a few weeks. But once you're healed, you can walk and swim and bike and golf and carry on and do what you feel like doing. As far as anesthetic choices, you can go to sleep, or you can have an epidural shot in your back like what a woman has when she has a baby. Either one of those is okay with me. We used to have people give their own blood ahead of time, but now I've got a fancy new drain that collects your blood and gives it back to you, and so usually we don't have you give your own blood ahead of time. There are risks to the surgery. There's a small risk of an anesthetic issue with any type of surgery, and there's also a small risk of an infection or of a blood clot. We give you special medication to help protect you against that. The actual surgical procedure takes approximately an hour. You're usually in the hospital for 2 or 3 nights. I expect you to need a walker for a week or two and then a cane for a few weeks. iStock Audio.